The Bale-Donine method differs from the standard of care in that, number one, stratification of whether you are doing primary, secondary, or tertiary prevention, and then looking for the root cause of the problem.
Their method really encompasses a lot more inflammation, really looking at the root cause, and then treating that cause very aggressively. And I just don't see that in the community. It's just not happening.
The Bale-Donine method, by the paradigm it has created, is much more aggressive at modifying the course of the things that drive atherosclerosis. And with that, I believe you are able to lower the event rate, and we're talking about heart attack and stroke, obviously, but also lower or reduce the progression of disease over time.
As a physician, if we really want to help our patients and ourselves, we really need to look at all of the data that we have available to us and all of the tests and put it all together and not just hope that we will not suffer from a heart attack or a stroke. There are things that we can look at that say, hey, we're at risk. Our patients are at risk. Now let's do something about it.
The Bale-Donine method aims to get patients at the best possible scenario for their cardiovascular risk. It looks at every possible risk factor and tries to decrease it, whereas current standard of care is really just looking at getting blood pressure to a certain goal, getting LDL cholesterol to a certain goal, and A1C maybe to a certain goal, but it doesn't really look at the whole picture.
So what it's made me do is really dig even deeper than I have been, really looking for that artifact that really is is inflammatory, or cat in the gutter as they call it. Really looking for that cat in the gutter and see where it's going to jump out at you.
So a different assessment, a different way of looking for disease, and a very, very scientifically based approach to preventing incidents of heart attack and stroke.
We'll be able to prevent many more events from happening than we are now by looking at some simple tests that really aren't that expensive compared to a lot of the other things that we ask patients to do. And we'll be able to help to prevent many more events from happening by changing the risk factors that those patients have.
Atherosclerosis is a dynamic disease. It's sneaky, it's ever-changing, and it's looking for weaknesses in patients' lifestyles, and you have to be vigilant over time in treating these patients to avoid problems. And the only way that you're going to do that is to involve the patient. I think the Bale-Donine method does all of those things very well.